Welcome to Intriguing Reports. I'm Waylon Holman. Tonight's guest is the distinguished Dr. Faust. Dr. Faust, welcome to Intriguing Reports. Our guest has sent in some questions for you tonight. Our first question is, have you performed any interesting operations lately?
Well, I did a little small gallbladder operation the other day, and actually I removed the wrong gallbladder. I know what you're thinking. Everybody just has one gallbladder. I'm aware of that. It's just that they said that it was the patient was in room 31, and I thought they said room 13, but everything's going to be okay because it's my hospital, it's my town, my state, my everything. Nobody's going to say anything, you know.
Our next question is, you haven't been fooling around with any Rohypnol lately, have you? On your patients, maybe? You know, the date rape drug?
Well, you know, of course, all of these accusations are politically motivated. I operate under the highest ethical standards, and I have nothing to do with any of that tomfoolery. All of these accusations are made up by my political enemies. They're all out to get me. They'll say anything. They'll say anything. You know how it's politics. It's politics. Politics.
Dr. Faust, are you on the take from Big Pharma?
You're not referring to that crazy woman that claimed just because I had her taking 53 different medications and that she was spending $11,000 a week on them, that somehow I was taking some sort of kickbacks. But I can assure you, just like with the other series of unfair and unfounded accusations, that all of this is politically motivated. That woman needed those medications, as witnessed by her insane tirade that she had down at her lawyer's office. So I think that that sort of embarrassment is best to be left sort of, you know, I'd rather not talk about it. Hold on.
Have the drug sales reps been offering you free trips to the ranch near Las Vegas lately?
Look, I've stated this before. I went to Las Vegas to the proctologist convention just so that I could update procedures at my clinic so that I could offer a better service to my patients. Just because I happened to run into a certain drug salesman who happened to have been seen at another location, which will remain nameless here if you don't mind. That's all a big coincidence. It's all a big coincidence. I had nothing to do with any sort of hanky-panky, monkey shines, or tomfoolery with the drug salesman. We're good friends. He's a good guy. He's a good friend of mine. He goes to my church. But I had nothing to do with any ranch or any chickens or any sort of peacock feather clad women prancing around or anything like that. Nothing. So thank you very much.
Welcome.
Just how much do you owe to the bank, and who's your banker anyway?
Well, Oh, quite a bit, actually, because I invested in the new hospital. I built my new clinic, all so that I could offer a better service to my patients to help give them better medical care, prolong their lives, make them more comfortable, happier, do all of these wonderful altruistic things for the community. That's what I'm all about. I want you to understand that. And in order to act in such a magnificent, munificent manner as I do, it costs money. So every once in a while, you have to make a small loan with a reputable banker. Mine happens to office in the Bahamas, and I don't divulge his name because we have a proprietary relationship. But I can assure you, he's very astute. Everything's on the up and up. As far as the investigations, I will not comment on those.
You don't have any balloon payments coming up, do you?
Me? A balloon payment as in creditor coming up soon, you say? Well, actually, there is an appointed date, but hopefully everything will work out before then, and I'll let's move on to something else.
Have you been bothered by bill collectors?
Bill collectors, you say? Bothered? Me? What is this, a commercial for Ditech or something? I mean, can't we change the subject, please? I mean, I thought we were here to talk about my distinguished career as a philosopher, doctor, and Renaissance man, shall we say.
Well, I guess that's all for tonight, Dr. Faust. Thanks for being our guest. And thanks for joining us tonight on Interesting Topics. I'm Waylon Holman.
Okay, we're rolling. All right. On today's show, we have a very special guest, ladies and gentlemen. This is the woman who we were referring to earlier, who was overprescribed, I believe is the term that's commonly used in the parlance of legal/medical jargon. Yes. And, of course, Dr. Faust alleges that this woman is crazy, but we can all see perfectly well that she is perfectly sane. There's nothing abnormal at all about this woman, and so let's just move right along with our interview. Good morning. What did you say your name was?
It is Alicia Cabrera.
Alicia Cabrera. Okay. And we understand that you were a patient of our friend Dr. Faust. Is that true?
Yes, it's true.
And apparently there's some kind of litigation. He mentioned something about a lawyer.
Yes, I apparently went off on a lawyer, and then he said I was crazy.
Oh, well, that's just terrible. I mean, how could he say that? You haven't had any, history of mental illness or anything like that, have you?
Not recently.
Oh, not recently?
Not recently.
Oh, okay. All right. So lately you've been okay. I mean, as far as not getting hauled away in any, straitjackets or anything like that, right? I mean...
No, I haven't been in a straitjacket lately or a padded room.
Okay, so I guess all these allegations about you being crazy are a little bit blown out of proportion then, huh?
Just a little bit. I try to say I'm eccentric. That's what I am. I'm just a little odd, not odd.
Yeah, well, Dr. Faust was alleging that you really needed those 53 different medications that he was taking. Is that really true?
I don't think he wanted me to function throughout the day with all them medications. So I don't think I needed them. I am
Yeah.
not crazy on no
And they were
pills.
costing $11,000 a week to take all of those pills?
I was having to sell my butt just to get all them pills.
Oh. Well, that sounds pretty bad, yeah.
Yeah.
So, Dr. Faust, of course, has this reputation as something of a Romeo, which he claims, or which he denies. He says that none of this is true, but and he also is supposed to be quite a wheeler dealer. So we're wondering if maybe he had to work out some of his bill on a sort of in-kind basis along those lines, huh?
Well, he did say I could pay for some of the cost by laying on his couch. Now, I don't exactly know what that means, but I'm not stupid. So.
Because he's not a psychiatrist, right?
Uh-huh. True.
Okay. All right. So, like, of any of these 53 medications, like, were any of them, like, mind-altering drugs, or, like, were all of them, or, like, most of them, or...
Oh, I was on, like, let's say 20 different antidepressants, and then you have your Valium Klonopin that, you know, just makes you feel nice and fuzzy, and then what else? You've got the Trazodone, and, you know, what else did he have me on? Trilevolin, Toradol, you know, he had me on just a whole lot of things. You know, he said to keep me calm and mellow.
Oh! So, I guess it worked out most of the time except for the incident down at the lawyer's office?
Yeah, then I just got mad.
Oh, I see. Okay. Well, would you recommend that anybody else go to see Dr. Faust?
If you have a really bad pill addiction, I'd be he's the perfect person to go to. If you love you some med, go there.
All right. Well, listen, thank you very much, Alicia, for your very informative interview.
You're welcome.
And as we always like to say on our program, you take it easy.
I sure will.
All right. Okay. Welcome to tonight's program. Our guest tonight is the receptionist and chief nurse at the clinic of none other than Dr. Faust himself, who's been a guest on our show many times. And what did you say your name was, sweetheart?
My name is Margaret Smith.
Margaret. That's the right name for somebody who would be working for Dr. Faust. As we all know, those of us who have read the book and the play and all of that, you know, it's quite a coincidence, don't you think? Huh?
Yes, very much so.
So, what's it like working for Dr. Faust? We've heard a lot of stories that he's considers himself to be something of a ladies' man, shall we say. What do you think of that?
He's a very charming man, but he's,
A little handy, you say? Sometimes,
sure.
maybe, yeah?
Yeah, you could say that.
Yeah, you haven't thought about, like, suing him or anything, have you?
For the money, maybe no. That was just a joke for the record.
Oh, right. I know he did say he was going to have a little talk with you about that. Yes. And let's see, is the clinic paid for as far as you know, or is he kind of in hock a little bit, maybe?
Nothing's ever mentioned of that. I really wouldn't know such things.
You haven't heard anything about his relationship with a certain banker from the offshore Bahamas outfit, maybe?
Possibly. There possibly could be.
Yeah?
And there's someone always calling the office for him. That sounds very professional.
Oh, yeah. Real professional type, eh?
Yeah. Telemarketers, or maybe bills not being owed.
Oh, bill collectors, you say?
Yes.
Yeah, bill collectors, right.
Yes. Possibly.
Okay, so he takes the calls himself, right? I mean, he probably instructed you not to be too
I
free
never
with
talk
any.
to them. No, he always takes the calls himself. Yes.
Yeah, well, that's good. Let's see. What about the story about how him supposedly going out to Las Vegas to meet the drug salesman and going out to this chicken ranch? You didn't hear anything about that, did you?
No, I wouldn't know such things. No, I don't know of anything. No.
He's a regular
but
church.
It wouldn't surprise me.
It wouldn't?
No.
Well, isn't it true that those two persons go to the same church and everything?
Oh, church? Possibly.
Yeah.
Yes,
Well, the preacher wasn't out there with them, was he?
I don't recall.
Okay.
I don't recall.
So, what about that woman that he mentioned that he prescribed 51 different medications and he said they needed them all? Do you know anything about that? Or
I know a lot of times he will prescribe medications to people just because they ask for the drug they pretty much prescribe themselves whatever they want, and he'll write them a prescription.
Oh, he's real helpful with people, right?
Yes,
I mean, because he's such a caring sort of individual.
He prescribes me my Xanax and whatever I ask him for. He's very good on that part.
And probably working around him, you probably have to use them or feel the need to quite frequently.
There's a lot of stressful events that happen in the office that no one probably knows of. Me.
Oh. Well, is he paying you enough?
Yeah, he pays me pretty good.
Yeah?
I'm paid well, yes.
Probably he doesn't pay you all that much in comparison to the value of some of these stories that you may know about or things that you might have seen or anything like that.
I can't say anything. I will definitely be in trouble if I say things I shouldn't say. So I try to keep it,
Okay, well, we'll talk about that later. All right, well, listen, thank you so much for being a guest on our show.
Thank you for having me.
Yeah, all right.
Nice meeting you.
Yeah, okay, well, as we always say, you take it easy.
You too.
All right.
Bill collectors, you say? Bothered? Me?
Someone's paging Dr. Faust, 'cause he's needed badly. He's the only doctor in the house, and I say this sadly. Dr. Faust, Dr. Faust, if he seems somewhat jaded. Dr. Faust, Dr. Faust, take on all the things he's traded, 'cause he knows how to drive a bargain, and he knows how to make a deal, and he knows how to hit the target, and he knows how to make you feel. He's the doctor. Whoa, and he knows everything. Dr. Faust. He's on the telephone now. Come to my house, Dr. Faust. It's time for you to come home now. For your deeds they were many, and your pleasures they were too, and your credit it was plenty, but now it's all due. So pay up please, Dr. Faust, pay your bill, Dr. the House. Give it up, my good Dr. Faust. But someone's paging Dr. Faust. Someone's paging Dr. Faust. Someone's paging Dr. Faust.